Thanks for joining today's webinar with the Oregon Health Authority. We are here for the webinar titled How You Can Connect Your Employees to COVID-19 Vaccines. A couple of quick housekeeping items. This webinar is being recorded and we will share the recording after the webinar. Toward the end of the presentation, we will open up the webinar for Q&A. To submit a question, use the box at the bottom of your screen called Q&A. Now I am going to turn it over to Kathy Kaufman.
Everybody, welcome. Thanks so much for joining us today. We've got a good turnout for this webinar. My name is Kathy Kaufman, and I am working with the Oregon Health Authority, as well as the governor's office to help roll out the vaccine program and to engage an array of employers in that effort. So that's what we're here to talk with you about today. I'm joined by a team of OHA employees who will help answer questions. I'm going to move my screen forward, and of course we're going to have a little bit of a technical difficulty. Here we go. Okay, so in addition to myself, I'm joined by Emilio Debes, who is a state health advisor and will be sharing information about vaccine safety and efficacy. Also joined by the migrant seasonal farm worker team, Maria Castro, Oliver Vera, Jorge Martinez Zapata, and the outreach team, Rob Smith and Amy Coven. So between us all, we think we'll be able to answer many of your questions. I'm going to go through a bunch of slides to share information along with my colleagues here. There is a Q&A box. We encourage you to post your questions in that Q&A box. The team will work on answering questions as they get posted or flagging questions for me to answer at the end of this session. So please post any questions that you have in that Q&A box. You can start posting them as we go along and add them at the end when we get to the Q&A session. Any questions that we can't get to in this session, we can provide a response to in follow-up. So again, thanks very much for joining us here today. One note, this webinar isn't intended for members of the media. This is really a webinar for Oregon employers who are interested in learning more about the vaccine program and how to share that info with their employees. If you are a member of the media and you're looking for information from OHA, please contact the Public Information Office, and the email for that contact is listed here. Okay. So our goals for today, we want to share information with you all about the vaccine rollout, how it's going, what's coming next, what we anticipate. We want to share information with you so that you can communicate with your employees about how, when, and where to get a vaccine. We're going to talk about an employer communication toolkit that we've developed for you to make that job a little bit easier. We'll talk about some future opportunities for partnership with employers around the state for vaccine administration. And then, of course, we want to hear and answer your questions and your feedback. Let me start by saying that as employers, as community leaders, you absolutely can make a difference in how quickly Oregonians get vaccinated, and as a result, how quickly the economy gets back to work. So we appreciate you being here and your interest in this topic. So where we are now. As of the end of last week, Oregon had administered 1.4 million doses of vaccine to nearly 1 million people. About 500,000 people in Oregon have been fully vaccinated. Others are in progress. They've had their first dose, but they haven't had their second dose yet. So for the last 2 months that the vaccine program has been running, undoubtedly you have heard or possibly experienced yourself about the severe limitations in supply. The good news is that supply is poised to increase pretty significantly over the coming weeks. We expect the supply to stay high through summer. And because of that, we anticipate that we'll be able to vaccinate everyone in the state, 16 years and older, that's who's able to get a vaccine now, who wants a vaccine by the beginning of June. So summer is looking very promising for all of us. So let me now share some information about when your employees will be eligible to get the vaccine. So again, because supply was so limited, eligibility for vaccine was done in phases. You've probably heard about some of these phases. For example, educators were vaccinated, people who are over 65 were vaccinated. The very first people to get vaccinated were healthcare workers on the front lines of fighting this pandemic. So we are again opening up eligibility. The governor announced on Friday that starting today, any migrant and seasonal farm workers who are already here and working are eligible to get a vaccine starting today. On Monday, another wave of eligibility opens, will be open to all migrant and seasonal farm workers, people with underlying health conditions and other groups. I'm going to talk about them in more detail in just a minute here. Then another wave starting on April 19th. That's the new date, eligibility date for frontline workers. And then in keeping with the announcement from President Biden, all people 16 and older in Oregon will be eligible to get a vaccine by May 1st. So by May 1st, everybody is eligible and we don't need to worry about phases. Until May 1st, we have a couple of more phases of eligibility. If you go to the covidvaccine.oregon.gov website, and you're going to hear us mention that many times today, as it is the place where all COVID vaccine information is kept, you'll see this graphic, which describes in more detail who is eligible when. I'm going to talk to us about Group 6, the group that's becoming eligible on Monday. So as I've already mentioned, Group 6, March 29th, eligibility begins, migrant and seasonal farm workers, noting that those farm workers who are already here and working are eligible starting today. Eligibility will also open up to seafood and agricultural workers, food processing workers, wildland firefighters, and people currently displaced by wildfires. Adults ages 45 to 64, that's because we've already opened up eligibility to anyone over 65, with one or more underlying health conditions with increased risk. And we're going to look at those in more detail in just a minute, but I want you to really pay attention to that category of eligibility because many of your employees will be eligible because the list of underlying health conditions are pretty common, and a significant portion of the adult population in the United States has one or more of those conditions. Eligibility will also open for pregnant people. This is for anyone 16 or older, people living in low-income senior housing, senior congregate and independent living, and then individuals who are experiencing houselessness. So just to call out the categories of eligibility that are based on employment, starting March 29th, migrant and seasonal farm workers, seafood and agricultural workers, food processing workers, and wildland firefighters. Here are the list of underlying health conditions that I mentioned. So anyone who's over the age of 45 and has one of these underlying health conditions will become eligible for a vaccine starting on March 29th. These conditions include all types of cancer, chronic kidney disease, COPD, which stands for chronic obstructive pulmonary disease, Down syndrome, heart conditions, including heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state from solid organ transplant or HIV, sickle cell disease, type 2 diabetes, and obesity. And the definition that Oregon is using for obesity is a BMI, body mass index, greater than or equal to 30 kilograms or more. So let's talk about frontline workers. As I mentioned, the eligibility for frontline workers has moved up. It was supposed to be May 1st. It's been moved up to April 19th. Frontline workers are workers in industries that are essential to ensure the continuity of critical functions in the United States. To be eligible, a worker must have a job they cannot do from home and requires that they also have regular close contact with others outside their house. They can't maintain 6 feet of distance, and routine, so more than 15 minutes per person, close contact with others outside their household. So people who have to show up to work, can't work from home, and in order to do their jobs are at increased risk because they have to get up front and close with many people throughout the day. In addition to fitting this category, the worker needs to be in one of the critical industries that have been identified by the CDC. And if you have very good eyesight, you can see the long list of industries. I'm going to put a link in the chat and that to see the complete list available from the CDC. But I will also link you to the information on that covidvaccine.oregon.gov website. Workers include grocery store and retail workers, colleges, postal workers, transit workers, manufacturing, food service, energy, public health, housing, water, wastewater, finance, legal, government employees, and the news media. So a long list of critical industries, and I will share the link with you. So let me talk about where and how to get a vaccine. So as supply increases, the good news is the places where you can go to get a vaccine have also increased. Right now, the opportunities include mass vaccination clinics in a number of places throughout the state. In the Portland metro area, there's the Oregon Convention Center, a drive-through at the Portland airport, a mass vax drive-through in Hillsborough. There's a mass vax center at the Salem Fairgrounds, at the Bend Fairgrounds in Deschutes County, and also a mass vax clinic in Southern Oregon for both Jackson and Josephine counties. So in addition to those mass vax sites, all local public health authorities in all 36 counties across the state are hosting vaccine events. Pharmacies now are also providing vaccine, including Walgreens, Safeway, other pharmacies across the state. Federally qualified health centers, so health clinics, federally qualified health centers are offering vaccines. Mobile clinics in regions across the state, tribal health authorities, Veterans Administration health providers. There are some work sites, worker housing sites where vaccine is offered, and primary care providers. There are a few primary care providers, a few primary care clinics that are offering vaccine right now in places throughout the state. And the number of those kind of providers will grow as our supply increases and more people become eligible. So that's a long list. How in the world do you find an appointment somewhere? Well, again, I want to direct you to that covidvaccine.oregon.gov website. This is what it will look like when you get to it. If you click on this yellow gold bar where the red arrow is pointing, you'll find a link to finding vaccine in Oregon. Once you click on that link, it will give you an array of options. You'll get links to all the retail pharmacies that are offering vaccine. You can click on any one of these links to get to the pharmacy's vaccine scheduling page to see if vaccine is available. You'll also see links to your local public health authority for any given county to find out what other local vaccine options exist. I would also encourage you all, as well as your employees, and information about this will be included in that employer communications toolkit I mentioned at the beginning, to register with the Get Vaccinated Oregon tool. You'll also find that at the oregon.gov site that I've mentioned. You can go directly to getvaccinated.oregon.gov to go there. And this tool essentially serves as a registry where you and all of your employees can sign up to be notified about a vaccine when you're eligible to get the vaccine and to get information about getting vaccine. So I encourage you all to sign up yourselves and encourage your employees to sign up with this tool. Let me pause for a minute and hand it over to Maria Castro, who will talk about our efforts to vaccinate migrant seasonal farm workers and agricultural workers. Maria?
Thank you, Kathy. Maria Castro, I'm a health equity program analyst with the Oregon Health Authority, and I've also been part of the response and recovery unit for agricultural workers in the state of Oregon, part of a large team of people that have been working nonstop to ensure that our agricultural workers have better outcomes based on COVID-19. So we are continuing to work doing testing, outreach, and education. And I won't speak about that, but we are doing comprehensive work on that area. You notice that we are speaking on the slide says migrant seasonal farm workers. Our team has expanded their reach, and we are now working with agricultural workers, and that definition includes migrant seasonal farm workers, but also many other eligible workers under the agricultural worker umbrella. We are starting to vaccinate agricultural workers. Many of our local federally qualified health centers already started doing it. We are vaccinating farm workers, including those who come to the United States with an H-2A guest worker visa. We are focusing on seafood and agricultural workers and food processing workers. This means that we have a large number of employers that we have to reach. And because of that, we developed an agricultural employer COVID-19 vaccine information survey. Some of you who may have links with the agricultural business community may have received this survey, a link to the survey. We are working with our stakeholders, the Oregon Department of Agriculture, the Oregon Employment Department, Oregon OHA, and many of the associations, and to ensure that this survey reaches agricultural employers. The purpose of the survey is to link employers with their local public health authorities through the Oregon Health Authority. Basically, in the survey, you will see that we are asking several questions. One of them is, are you an employer of agricultural workers, and would you like to host a workplace vaccine event? Then there is another question that says, you are an agricultural employer, but you would like to connect directly with your local public health authority or your local federally qualified health center. Then there is another question that says, would you like to work with us to mention entities and have them allocate spots on mass vaccine events for your workers? And then there is a fourth bucket, which is, I am an agricultural employer. I don't want to work on this, but I would like to be able to share information about local vaccine events so I can share them with my employees. So that is the way we are working on this. We are receiving the information and immediately sending it to our local public health authorities so they can reach out to you and see what works best. And we have received a couple of hundred answers already. We're hoping to receive some more. And this is only one of the many ways we are hoping to reach this particular population. all our systems that's set up so information is in plain language, translated to the languages that are most common among agricultural workers, including indigenous languages. We are working with community-based organizations, so workers can receive education about the vaccine, what happens once you get vaccinated. And we are trying to support our local public health authorities when they organize mass vaccination events. So our community-based organizations can support by providing information in languages and in a manner that it's culturally and linguistically responsive. So that's all I have, Kathy.
Thank you so much, Maria. Okay, so some information for you and your employees to know before going to get a vaccine. So one, COVID vaccines are free for everyone in Oregon. No one has to pay for a vaccine. It's really important everyone know that. You do not need health insurance to get a vaccine. You won't be charged. But if you do have health coverage, we encourage you to bring your health insurance card, as it's important information for the people who are doing the vaccine to collect so that they can bill the insurance company for the costs of running the vaccine clinic. You do not need to show proof that you are eligible. I see there are a lot of questions in the chat, not surprisingly, wondering, is my industry eligible? We encourage you to read the guidance that is available on the Oregon vaccine website. That will tell you what industries are and aren't considered critical infrastructure, and therefore whether or not your employees who need to be on the front lines are eligible. But there is no proof required. No one needs a letter from the employer or any other kind of documentation to demonstrate that they truly are a frontline worker. Instead, it's all self-attestation. We encourage you and to remind your employees to be good community members. This is moving fast. We are getting to the point where all of us will be able to get our vaccines very quickly. It's important that in the few weeks we have before eligibility opens up to everyone, that we work together to prioritize the people who truly are at more risk, either because they have a health condition or because of the kind of work that they have to do. So please read the eligibility guidelines. We won't be able to answer every single person's question about whether or not their particular business is eligible. The guidance that's available should give you the information that you need to know, interpret it appropriately, and make sure that when you share the information with your employees, you send that message to them as well. You do not need to provide a social security number. Some sites, depending on the appointment software that they use, might have a space for a social security number, but no one needs to provide it in order to get a vaccine, neither when they're scheduling an appointment nor when they actually get to the place where they'll receive their shots. You do not need to be a US citizen to get a vaccine, and it will not affect your immigration status nor be counted as part of public charge if you go and get a vaccine. For the sake of all of our health, it's really important that every single person in Oregon be able to access the vaccine. So let me talk for a little bit about vaccine confidence, and then I'm going to hand it over to Emilio, who will share some information on vaccine safety and efficacy. As I'm sure you all already know, folks on this call may be in this group. Not everyone is ready to get their vaccine. Some folks have lingering questions or concerns. Overall, when we do some survey and focus group work, we're finding that 20% of people in Oregon say they won't get the vaccine. That's a statewide number, and likely lots of regional variability in that. Another 40% have some reservations. They're saying either, well, I'll likely get it or I likely won't get it. They're sitting on the fence. It's incredibly important that we all work together to build vaccine confidence. In order to do that, we need to share widely information about safety, about the effectiveness of all the vaccines, and about side effects. And for people who are hesitant, know that seeing someone they know get the vaccine and seeing that they're fine makes them more likely to go get vaccinated. That's a really important piece of information to know as you think about how to communicate effectively with your employees. So now let's move on and share some information about the vaccines themselves. Emilio, may I hand it over to you?
Yes, please go ahead. Hi, good afternoon, everybody, and thank you for having me. As we talked about the vaccine, this is a reminder that the vaccine authorization went through an emergency use authorization. And the reason why is because of, one, it was a global pandemic, lots of people obviously getting sick and dying from the disease. And that alone with the amount of funding what was provided and the information that we had about the previous use of other modes of creating vaccines allowed for this vaccine to be created. No steps were ever missed during this process. It went very quickly. 40,000 to 80,000 people were vaccinated in the trial, as trials to make sure that the vaccine was not only effective, but safe. Next. So as you can see right now in the United States, 3 vaccines have been approved. There's a minimum age, somewhere between 16 and 18 years of age. 2 of them, the Pfizer vaccine and the Moderna vaccine, require 2 doses. They can be 21 or 28 days apart. They're highly effective, which is excellent. It's kind of the best way, the best scenario for everybody, 95 to 98%. And then the vaccine, the effectiveness of the vaccine comes in 2 weeks after the second vaccine has been administered to that individual. For the Johnson & Johnson vaccine, again, the minimum age is 18 years. It's a single dose vaccine and it's about 93% effective, which is again, best scenario for everybody. And people become fully immune or 93% immune after 28 days. Next. So side effects from the vaccine are questions that we get on a regular basis. And as people have gotten other vaccines, and remember, we get vaccines throughout our life as we're kids and we get older, and we get the flu vaccine every year, at least a lot of us do, and you should too. The vaccine, every vaccine has a side effect. It has side effect in animals, it has side effect in humans. It's no different. Local pain reactions, local site redness, swelling, it's fairly common. We've heard of other people getting joint pain, headaches, fever, muscle ache, being tired. Those are things that some people will develop, and it is an individual thing. It's something that the individual will develop against the vaccine, and that is just a way of the body telling you, yes, I got the vaccine, yes, I'm actually creating immunity, so I can actually protect you against COVID-19. So it is a good thing. It doesn't mean that if you don't develop side effects that you're not as immune. Again, we're talking about each body being different and every individual responding to a vaccine differently. I get local pain when I get the flu vaccine every year, and that is just a way of my body telling me, yes, I got the vaccine, and yes, I'm responding to it. Next. So after the vaccine, obviously, just because we got vaccinated, we got to remember, as it was mentioned before, that immunity has to be within a large number of the population. The community has to be immunized or protected against the disease. In the meantime, be respectful to other people, wear a mask, socially distance until we have enough people within the Oregon community vaccinated against the disease. So why? Because you may carry the virus without symptoms, and because you may actually pass it on to someone else. That someone else could be a person that has underlying conditions, could be an elderly individual, could be somebody that may be affected by the disease much more severely than you could. Next. Thank you.
Thank you so much, Amelia. Okay, so now let's get to how you all as employers can help Oregonians get vaccinated. So at the very top of this list, and an ask to all of you, please share information and even stories with your employees and frankly with your customers too, if you're interested and willing. Sharing information about the vaccines with your employees through emails or company newsletters or social media and staff meetings, however you can do it, will be tremendously helpful in spreading the word. I'll share with you in a minute the toolkit we've developed to help make that job a little easier for you, that provides tools to explain when, where, and how to get a vaccine, vaccine safety information for employees who have questions. And the toolkit includes materials for emails, newsletters, social media, and more. And again, remember that hearing stories of people getting vaccinated is what is proving to be most motivating for those who have questions or concerns about the vaccine. So please do what you can to share those stories of either you or other members of the staff getting a vaccine. Another ask to consider, do what you can to reduce barriers to vaccine access. Offer paid time off for vaccine appointments and to recover from any side effects. Help provide transportation to local vaccine sites. Reimburse any expenses employees might incur going to get vaccinated if they've got to get there on their own. And as eligibility opens and supply increases, there will be some opportunities for large employers to host on-site vaccine events for employees and even communities. Again, some agricultural employers, seafood employers will have the opportunity to host on-site vaccine events first. That's the link that was sent out in the chat. And as a reminder for those who are interested in hosting on-site vaccine events, you are going to need a healthcare partner in order to be able to do so. And I'm going to talk a little bit more about that in a minute. Another ask, support vaccine efforts in your local communities. Oregon, like every state, is in an all hands on deck situation when it comes to COVID-19. The more we can work together and help each other, the faster we can get through this. So please consider what you can do to support vaccine efforts happening in the communities where you do business. Ideas include offering space for community-based vaccine events or volunteer support for those events. As schools are opening up, many organizations across the state are losing the vaccine sites they've been using, say in high school gyms. So we'll be in need of space. So offer what you can if you have it. There is a shortage of people who can give vaccines. So I know some of you, certainly not all of you, may have employees who have a clinical license, who have experience giving vaccines. Put out the call to your employees, your networks, your customers, asking them if they've got past professional training in giving shots to sign up to be a volunteer. And we've got the link here for the serve-or.org site where volunteers can register. Okay. Now let me share the resources, the toolkit, and some other resources that we wanna bring to your attention. So we have developed a short toolkit. It is on our website, and I'm going to show you how to get there. Inside this toolkit includes talking points and key messages about the vaccine, a sample letter or email that can go out to your employees, newsletter content, social media content, FAQs, some materials that have been developed by the CDC, including posters and flyers, vaccine fact sheet, stickers, and even a photo novella talking about someone going to get a vaccine. So all of these are great resources, and we want to make sure that you have them at your fingertips so that communicating with your employees is as easy as it can be. So again, the toolkit we've developed answers these questions. Why should I get a vaccine, and is it safe? Will it work? Who can get the vaccine? When can I get the vaccine? How will I know when I'm eligible? And then where do I go to get a vaccine, and what do I need to know to get there? So here is what the covidvaccine.oregon.gov website looks like. You see this yellow arrow at the top by community resources. If you click on community resources, it will take you to this page. And on this page, we have resources, communication materials for the general public, and then, communication materials for specific groups, including employers. And there is where we have a link to the toolkit. We have it available today in both English and Spanish, and more translations are in the works. So in addition to the toolkit that we've developed, we also wanted to highlight for you another resource. This is a national resource aimed at businesses, healthaction.org. It's been developed by the CDC, the Robert Wood Johnson Foundation, the Ad Council, and then a significant number of large corporations across the country, as well as other businesses. We encourage you to visit this site, look at the resources that they have available, and if you're interested, sign up to be part of their network and their list. Lastly, just want to share some guidance around employer messaging. So one, if you have represented employees, we encourage you to partner with the labor unions. Unions are incredibly effective messengers for their members, so please consider working with them and coordinating with them on messages out. For your messages, lead with empathy and speak to shared values. Emphasize that vaccines are safe and effective. Acknowledge concerns. Provide scientific, unbiased answers, but just acknowledge that it's okay to have concerns. Acknowledge that it's going to take time to vaccinate everybody. Not everybody's going to get the vaccine the day that they're eligible. Our outlook is optimistic based on the supply that we anticipate receiving, but it'll still take us a number of weeks to get through all of the people who are ready and willing to get a vaccine. You don't have to ignore that there are side effects. You shouldn't ignore that there are side effects, shouldn't diminish them, don't exaggerate them, just factual, scientific, unbiased answers so that people can make the best decision for themselves. And then remind your employees, when enough people get a vaccine, we'll be able to see our loved ones, we'll be able to hug parents, grandparents, see our friends and family again, celebrate holidays, and go back to a life that is hard to remember 54, 55 weeks later here in the pandemic. So let me talk lastly, before we answer some of your questions, about the opportunity to host on-site vaccine events. So as I mentioned, as eligibility expands and supply increases, there may be some opportunities for some businesses to host on-site vaccine events for their employees, or even open it up to the community. I want to be clear that on-site vaccine events won't work for every business. We'll need to have a large number of employees need to have a healthcare partner. These vaccines are far more complicated than flu vaccines. So for those of you who have hosted flu clinics in the past, that's good experience, but it will take a lot more planning and logistics for the COVID vaccines. And in any event will require a lot of time and planning and coordination with local public health. So that's not to say we aren't incredibly excited about the opportunity, and we'll be working to help develop some on-site employer vaccines or other employer-based vaccine events, but just want to be really clear about what it will take to host those, and that it won't be something that every employer who's interested in doing it will be able to do. So if you are interested, I'm going to ask that you review the CDC guidance, and I'm going to throw a link in the chat, and the link will be available on our website for planning vaccination clinics. It will help you understand some of the logistics that go into developing these sites. Again, I want to acknowledge that we've got some businesses working on these opportunities now. Our agricultural seafood industry businesses can be doing that now. I just put the CDC link in the chat. And then of course, we'll be really interested in working on opportunities for employers of frontline workers, including grocery store workers, in preparation for their eligibility starting on April 19th. So for a timeline, next steps, right now, our ask is please start communicating with your employees about vaccine available now. We are turning the corner where we expect to have a lot more supply and therefore a lot more appointments. And it's time for us all to link arms and do as much outreach and communication about this as possible. Remember, even if you're thinking that your employees aren't eligible until April 19th, or maybe not until May 1st, remember that a significant portion of adults in the United States have one of the underlying health conditions that will qualify them to get a vaccine starting a week from today, Monday, March 29th. So be sure to share that messaging with your employees. And again, no proof of your health condition is required. Your employees don't need to talk to you about their private health information. Simply make sure they know that if they have one of these underlying health conditions, they are able to get their vaccine starting on Monday, rather than waiting until April 19th when they might get it because of employment status. Also, ask your employees to help spread the word. Help them share this information with their friends and families. And keep on communicating with your employees. And again, the covidvaccine.oregon.gov website is your best resource for information and materials to share. Lastly, encourage you all to think about how else you can help. Connect with your local public health office to offer support for vaccine events or other efforts. A link to each local public health authority is available from that covidvaccine.oregon.gov website. Ask if any of your employees are able to serve as vaccinators and encourage them to sign up with Serve Or. And then consider whether or not hosting an on-site employee vaccination event makes sense for you. Review that CDC guidance and see if it's even feasible for you. Appreciate that not every employer business that wants an on-site event will be able to do one. And again, just want to reflect that agricultural businesses, seafood processing businesses are working on these opportunities now. Fill out that survey that Maria shared and we put in the chat as a link. So that is the end of our slides. I know we've got a bunch of questions, so I'm gonna turn off the screen sharing and answer what we can. So Rob or Amy, our open questions will be where I start. Jump in if there's something else. Will there be an employer survey or link for frontline worker employer groups? So yes, thanks for that question. We will be developing a form. We're working on our process for opportunities for employers of frontline workers or just broad employer sites over the next week or so. And you will see a link appear right where in the same place where the toolkit exists for you to submit a form saying you're interested in doing a large employer on-site vaccination event. Now, I want to reflect that some of you on this webinar right now may already be working with your local public health office on a vaccine event. That's fantastic. You should proceed. We encourage you all to work through your local public health authorities. We are going to offer an opportunity to submit a form to do an employer vaccine site for large employers, and we'll get you more information on that as plans are developed in the very, very near future. Okay, so a question about what is a large number? So a large number will depend from region to region. Someone who's considered a large employer in the Portland metro area, there might be a different answer in different regions of the state. We will provide, we're working on that right now, we will provide some clarifying guidance on what we think is sort of the starting point for considering an employer site vaccine event. A question here, if we offer paid time off for vaccine appointments, can we require they show proof of vaccine when they return? So I'm going to encourage you to work with your HR staff and your legal guidance on questions like that. We don't want to be, you don't want our advice on this. You want advice from folks with experts. So I would talk to your HR and your legal staff for the answer to that question. Another question, for people who are houseless, can they sign up if the site requires an address? Do they also require state issued ID? So one, no one needs state issued ID in order to get a vaccine. You might be asked for your insurance information, or a driver's license in order to bill an insurance company, but no one can be required to provide a social security number, a picture ID, anything in order to get the vaccine. The vaccine is available whether you have an insurance card to show or not, and you will not be asked for proof of your ID. There is an entire plan for reaching out to people who are houseless. Each local public health authority is working hard on local level plans, and at OHA there are also plans to bring on 150 community-based organizations as contract grantees to help support some of those efforts. Okay. So a question about currently out in the, what does currently out in the fields mean? Does that include back office support who work out of the nurseries? So again, I'm going to point you to the guidance that is written about which workers and which industries. Read that guidance very carefully to see whether, just determine which of your employees qualify. As a general rule, it's, what employees are at risk, who can't work from home, who has to interface with many people all day long without being able to maintain social distance the entire time, and in one of these critical industries. Other questions or comments? Okay, it's looking like we've got everything. I want to thank you all for participating in this webinar. I want to thank you all for being willing to share information with your employees and spread the word about vaccine availability. We are genuinely grateful for your partnership. We are genuinely grateful for all you have been doing over the last year to keep Oregon open and working. And we look forward to a continued partnership with you as these vaccines roll out. Thanks very much, everybody.